Thank you so much, Ella, for that wonderful welcome. It's my great pleasure to be with you all today at this fantastic event, and I'm really looking forward to the rest of our 2 days together. So I've got, I think, 25 minutes, and I'm going to be talking to you about the role of digital technology in improving our mental health. I'm going to be sharing with you some of the work that's been happening in this area in the UK and beyond. As you know, my name is Becky Cotton. I'm Director of Policy at the Mental Health Network, which is part of the NHS Confederation. It's the national organisation for providers of NHS mental health services in England, and I work with chief executives and chairs from NHS mental health services across the country every day on a whole range of issues, so not just digital stuff, funding, regulation, and helping to spread good practice across our system. But one of the areas I've been particularly focusing on in the last couple of years is that of digital technology. So hopefully I'll have some interesting insights to share with you all on that today. You be the judge of that. First, a bit of context for those of you who were in Finland. So for those of you who perhaps aren't too familiar with the UK system, there's a well-known British politician called Nigel Lawson, who's actually the father of Nigella Lawson, who's probably more famous worldwide in terms of her cooking. He once famously joked that the NHS is the closest thing the English people have to a religion. And there's some truth in that, because I was watching the opening ceremony of the Pyeongchang Olympics on Friday, and I was thinking to myself, what other country in the world other than England would make their public health system the star of their opening ceremony at the Olympics, which this photo is from 2012, just a few miles away from where I live in London. And that does perhaps demonstrate the special place the NHS has in the life of the British public. People are very proud of it. And our health system is something that's rightly celebrated for much of what it does. Many Brits would say that they're proud to be from a country where if you have a health problem, whether it's a physical problem or a mental health problem, you can access services that you need largely free at the point of use, regardless of whether you have private insurance or regardless of the size of your bank balance. And this is particularly the case when it comes to mental health. We've got really big challenges in our system about how best to provide those services. So many of these challenges will be very similar to challenges across the countries that you're all from. But for example, we know that 1 in 6 adults at any one time are experiencing a common mental health problem, such as anxiety or depression. We know that in the UK, we've got some really big demographic changes that we're dealing with, particularly, namely that our population is getting older. It's becoming much more diverse, and it's growing. So according to analysis from the Mental Health Foundation in the UK, we know that all of those demographic changes taken together will mean that we've got 2 million more adults in the country who will have mental health problems by 2030 than there are today. And we've already got a really, really, really big problem in terms of unmet need when it comes to mental health. So analysis that have been carried out by various bodies, including the LSE, show that currently anything between 2/3 and 3/4 of people with an anxiety and depression are currently not accessing any treatment for that. And the stigma that surrounds mental health that stops many people are asking for help when they may need it. That may well be a big part of that. But we've seen many successes in many countries campaigning to end that stigma. In the UK, led by charities such as Time to Change, and more recently with the Duke and Duchess of Cambridge and Prince Harry and their Heads Together campaign. We're beginning to see some really positive changes in terms of public attitudes, and hopefully creating the conditions by which people will start to come forward for help. But when they do come forward, the challenge will be to ensure that there are services there to help them. At the same time, we're seeing rapidly changing behaviour in the way in which people want to access services. So in a world where much of what we do has been revolutionised by digital technology, our access to banking, the way we do our shopping, the way we consume our news, people are wanting to access health services in different ways, at a time convenient to them and without long waits. And long waits is something that historically we've struggled with at times in the NHS. And there's also big cultural changes going on in mental health. From what we might traditionally call a medical model, where there's been a lot of focus on managing symptoms, to a more recovery-orientated model of care, which focuses not just on managing symptoms, but around a picture of individual lives, goals, and aspirations. So partly as a result of stigma and a perception services aren't there, many people don't access treatment when they could well benefit from it. More specifically, in terms of services, demand is rising in England. We had 2.6 million people in contact with specialist mental health and learning disability services in 16-17. That's nearly 5% of the entire population. Also in that same year, we spent 11.6 billion of the overall health budget for England on mental health, which sounds a lot, and there's commitments to increase that budget over time, in part because there's been such a public and political focus on mental health in recent years in the UK. But however, like many Western countries following the financial crisis of 2007 and 8, we've been in a period of austerity for the last decade when it comes to public services. In the 5 years from 2010, for example, mental health NHS trusts were reporting cuts in relation to their budgets of around 8%, 8.25% in real terms when you take into account inflation. So there's real scepticism out there about whether the big promises that have been made about boosting mental health funding, whether that cash is going to make it to the front line and whether it's going to enable services to keep up with demand. So using digital technology is clearly one way in which the NHS is looking to address some of these challenges, of those changing expectations, of rising demand and limited resources. Our current national strategy for mental health, that's the 5-year forward view, has clearly set out some aspirations around expanding access to digital mental health services. Back in 2014, I led on a report for NHS England looking at the landscape for digital mental health in the UK. As part of that, we surveyed leaders from organisations delivering NHS services about their current levels of digital maturity and their plans for the future. And whilst there was clearly a big interest in the potential for digital technology to support transforming the way we deliver those services, levels of maturity were quite low. The major barriers to change seem to be the current skills of the NHS workforce. People talked about that a lot. Low levels of IT literacy, and a lack of investment and support to identify opportunities by which integrating digital might make a difference. So since then, there's been various initiatives taking place aimed at making the most of technology in the NHS, particularly through the National Information Board's Strategy for Technology in Healthcare, which was launched nearly 4 years ago now. That came with £4.2 billion of investment to make the most of such opportunities. So, as part of that programme, NHS England are currently supporting a number of NHS providers with funding, international partnership opportunities through their Digital Exemplars programme. That includes 7 mental health trusts around the country, and I thought I'd share with you all a bit of a snapshot about what they're doing as part of that programme. So Merseycare NHS Foundation Trust is a very large provider in the Liverpool area in the north of England. They've had a big focus in their trust around suicide prevention, which has been a big area of concern. And they secured £5 million in funding for the programme, which is being led by their medical director to support a number of projects. One of those is about partnering with Stanford University in California to develop an app which will support staff anticipate and respond to risks of self-harm and suicide risks amongst their service users. Worcestershire Health and Care Trust are a provider of mental health and community services in the Midlands. And as part of their work on the programme, they are doing work to move from multiple patient record systems into one system across the organisation. They're also working on mobile access to the patient record system, which will be rolled out to enable staff that are currently, they're not at a desk, they're working out there in the community, delivering care in people's homes, in order so that they might be able to access and update patient records. They also have a plan to improve their overall digital infrastructure, including access to Wi-Fi across the estate and developing mobile apps to improve services for patients and carers. Northumberland Tyne and Wear NHS Foundation Trust, they're a massive trust up in the northeast of England. They're one of the largest in the country and employ around 6,000 staff. They have a very committed senior team on this, including their Chief Clinical Information Officer, Joe MacDonald, and Darren McKenna, their Director of Informatics. Joe has previously said that they want to use the trust position as a digital exemplar to, in their words, easy jetify, I don't know if that translates, mental health provision. In other words, to make people's experience of using their services as smooth as booking a low-cost flight. They're looking to deliver digital patient services, including GP referrals, online consultations using Skype. Joe thinks that might help them make a real difference when it comes to reducing the number of no-shows they have for consultations, which we're running at about 25%. They also want to enable patients to access their records online, complete assessments, and provide feedback online as well. Oxford Health NHS Foundation Trust are another big trust providing both mental health and community health services in the south of England. They have a chief executive, Stuart Bell, who's long shown a keen interest in this area, and they've also secured £5 million through the programme to support a whole range of projects. They're already quite an advanced trust in sort of by our standards, so they already use video conferencing like Skype and FaceTime to support patients in their home. And 90% of those patients feeding back said that they found that really helpful and excellent. Clinicians can already access the Trust's electronic health record system from anywhere. They have 3,000 iPads across their Trust that their staff are able to use. In the future, the Trust aim to continue to develop technology to improve patient care, access to information, and find ways to cure and treat conditions and diseases. Patients, families, and their loved ones will be able to remotely access their personal health record to review their care plans, progress, and research preferences. The most up-to-date electronic patient notes will be available to clinicians across the Trust and partner organisations. And more people are going to be offered physical and virtual treatments in their own home. In partnership with the University of Oxford, the Trust is developing a platform for online therapeutic interventions which patients will be able to access anywhere via their own devices. So that gives you a bit of a flavour in terms of some of the work that's going on as part of that specific programme. But it's important to say that there's already great existing examples of collaborations between the public and private sector in this area, which is so important for bringing together the right skills in order to properly leverage the opportunities that digital has got to offer. So 2 organisations that have got a long track record of working with the NHS in the UK, I'd highlight a Big White Wall and IESO. I don't know if they're familiar with people in this room. Big White Wall are founded by a British social entrepreneur called Jen Hyatt. She's a fantastic woman. They now operate in the UK, New Zealand, and Canada. It's an online social community of members who can share what's troubling them in a safe, supportive environment. They have moderators on there 24/7. If somebody has a concern about safety, they're there to do the right thing. People who are members of that can also access guided courses and tools online aimed at supporting recovery, and they can undertake assessments. Big White Wall is free to access through the NHS in many areas of the country, as well as, I think this is supported by our government, that it's free to all serving members of the armed forces and their families too, and about 500,000 students as well, because mental health amongst young people is a particular issue at the moment at home. It's free to access for them as well. They've also partnered with a number of NHS trusts, bringing their expertise around digital provision to help existing mental health services provide more therapy services online. IESO Digital Health have done a bit of work. They're an organisation, they're active in the US, but they're also based in the UK, based in Cambridgeshire. I don't know if people are familiar with Silicon Fen, the whole environment around Cambridge. They're currently commissioned by 40 clinical commissioning groups, and those are the organisations through which NHS money flows. They're commissioned by those to deliver online CBT services under the NHS, which is delivered through written conversation. So patients meet with a therapist in a secure online therapy room at a time and location convenient to them. And in some areas of the country, not everywhere, patients can refer themselves directly for free under the NHS. There's also some great examples of collaboration between clinical, academic, and industry partners. I thought I'd highlight this because I think it's a particularly exciting initiative that was launched in 2016, the Centre for Translational Informatics, a bit of a mouthful as a title, but that's led jointly by the South London and Maudsley NHS Foundation Trust and the Institute of Psychiatry. The Maudsley's chief executive, Matthew Patrick, is someone I've worked with before on exploring the role of digital technology in mental health care. And previously, he was the chief exec at the Tavistock and Portman NHS Trust, which actually incubated Big White Wall and that when it was sort of initially developed. The Maudsley itself have been engaged in many projects in this space over the years. So they had the Number 11 project headed by Kumar Jacob, which was looking at the application of technology in service delivery, including looking at wearables and other sorts of things. Now they have this centre, which was launched the other year, and they're bringing together clinicians, academics, including in Cambridge and the University of Michigan, along with industry partners like IBM and Fitbit. And they've got a range of exciting projects happening at the centre right now, including a virtual companion app for children with ADHD called Agents in Records. And that's currently being trialled by 200 children, which is a trial that's being funded by the Guy's and St Thomas's charity. The kids using that can record their mood, behaviour, and activities on a regular basis. Users can also access resources and tips for managing symptoms. And then all of that data that's recorded in the app is then fed back in real time to the user's electronic health records. So that enables clinicians to identify problems earlier and offer more timely treatment. Users can also choose for their information to be shared anonymously for research purposes, so ultimately enabling improved experience and outcomes for people with mental illness. The team that are leading that particular piece of work, there's great potential for using that approach with a range of different mental health conditions, and there are now plans to use it to help people with addiction stay on the road to recovery. So there's another project that they've got called BioYodi, which is using text mining techniques to access and analyse information contained in the unstructured parts of medical records about patients' experiences and history. And these tools can aid clinical decision-making, generate data for research, and speed up recruitment to clinical trials. The team at the centre say that that's now being used by a number of NHS trusts across the country. There's much more happening at this centre than I could briefly set out here. So for those of you who are interested in that particular model, they have a website with loads of information. I'd highly recommend checking it out. In terms of industry collaboration relating to wearables, they're working with industry partners like Fitbit and Intel to explore how mobile devices and wearable fitness monitors could help prevent relapse in schizophrenia. So that's a project called Sleep Sight. Depression, multiple sclerosis, and epilepsy. There's a few different projects that are talked about online. And just lastly, a brief word on what we at the NHS Confederation are going to be doing next in this area. One of the things we're very keen to do is support spreading good practice amongst the NHS and also learning from international systems, which is what makes coming here so exciting, to hear about some of the work that's going on in your respective countries. I've also been awarded a Winston Churchill Memorial Trust Fellowship this year, so that's going to enable us to go and visit and learn from some of these systems in Australia and the US. So a couple of interesting, quite famous if you're kind of into this particular field, but Crisis Text Line in the US is an amazing model. They provide support to anyone experiencing a crisis through text messaging. And they also collate that data on who is contacting them and about what. They anonymise it, and it's available for policymakers, journalists. But in terms of promoting better public mental health, it's a fantastic resource. And I'm looking forward to going and learning more about that. One of the systems that are perhaps way more advanced, I think, than particularly in the UK, are our colleagues in Australia. Their government published their first ever e-mental health strategy back in 2012, and they've really led the way in terms of making mental health advice and treatment available online. So their government's recently launched something called Head to Health, which is for anyone who's concerned about their own mental health or someone that they care about. That provides advice and signposting to publicly funded online mental health services. Their e-Headspace service, that's for young people aged 12 to 25. It's integrated with their Headspace service, which is their young people's services. That provides an online counselling website that's available 24 hours a day, 7 days a week. They advertise it on TV over there. It's a big thing. Butterfly Foundation and Beyond Blue also provide online support and forums. And Beyond Blue have recently launched online low-intensity CBT services for people with anxiety and depression. So we'll be undertaking more research into these models in 2018, and we'll publish a report later in the year. So finally, I just sort of leave you with this thought. The challenge we're all facing around mental health is absolutely enormous. The scale of unmet need in every country is huge. I'm familiar with the statistics in the UK, but I'm sure it's probably not that different here either. The scale of that is massive. To have 2/3 of people with a health problem not accessing the help and support that they might need is enormous. And traditional service models are not going to be the thing that comes in and fills that gap. No health system in the world can possibly afford to do that. So where's the solution? And that really has to be where digital technology comes in. So I'm looking forward to seeing how things develop in the UK and what we can also learn from you guys here. So thank you very much.